Members, we're just going to start. So you're hereby summoned to attend the monthly meeting of the Health and Community Committee, which will be a hybrid meeting conducted remotely via WebEx and physically in the Council Chamber, Day Road, Strabane, on Thursday, the 14th of November 2024 at 4 p.m. So we'll just commence with attendance. So Alderman McMorris.
Online, Karen.
Alderman Montgomery.
Online, Karen.
Alderman Wilkinson.
Online.
Councillor Boggs.
Sure, Karen.
Councillor Boyle. Councillor Clark.
And Shaw.
Councillor Deeney. Councillor Duffy.
Apologies, Karen.
Councillor Farrell.
Online.
Councillor Harkin. Councillor Heaney.
One shot. Online.
Councillor Hutton.
And Shaw, Karen.
Councillor McDade
Is currently in traffic.
is currently in traffic. And Councillor Tierney. Okay, thank you, members.
All right, members, we'll just read out the broadcasting statement. I would like to remind everyone physically present at this meeting or in attendance remotely that this meeting will be broadcast live to the internet and will be capable of repeated viewing. This broadcast may be terminated or suspended in accordance with our protocol. Due to your attendance at this meeting, you are consenting to being filmed and to the use of the storage of those images for broadcast or training purposes and for the purpose of keeping historical records and making those records available to the public. Members and approved speakers are reminded to only have their mics and cameras on while speaking at the meeting and to use the chat facility to highlight a request to speak. A copy of the Council privacy notice may be found on the Council website. And next on the agenda is declarations of members' interest, which we can do now or as we go. Perfect. All right, item number 10 is our deputation today, which you're all very welcome. We have a presentation on children's occupational therapy services from the Trust representatives, Donna Keenan, Eileen Dolan, Patrick Conwell, and Chris Curran. I hope I haven't forgot anybody. All right, so thank you so much for being here, and I'll hand over to yourselves.
Thank you. Good afternoon, everybody. My name's Donna Keenan, and I'm the Director of Nursing Midwifery and AHPs. Today with me, I've got Eileen Dolan, who is our Assistant Director of AHP Services, Patrick Conwell, who is our Head of OT Services, and Chris Curran, who is our Public Affairs Manager. And I'm going to hand over now to Patrick to do the presentation. Thank you.
Afternoon, everyone. My name is Patrick, and I'm the Professional Lead OT for the Western Trust, and I'm here representing both the Paediatric Occupational Therapy Services and Core Community Occupational Therapy Services based on the motion that was here previously. So thank you for the invitation and the opportunity to talk to you about the Core Community OT and Paediatric OT Services. I hope that this paints a picture of the challenges in both services and what we are trying to do to address these challenges. What I'd like to get across today is the occupational therapy process and what that involves and the service user complexity that exists on therapist caseloads. So just a wee bit of a background. We have three bases for each of the two services. Paediatric OT are based in the Children's Centre in Southwest Acute Hospital, the Children's Centre in Omagh Hospital and Bridgeview, Grantia Park. The Community OT services are based in the Erin Health Centre, Omagh Hospital and Woodview in Grantia Park. So just a little bit about our change in population needs. There's a small population growth predicted, but significant growth in age 65 plus with an 18.5% and then an 85 plus 28% projection. 1 in 4 people live in poverty. 5 of the top 10 most deprived areas in Northern Ireland are in the Western Trust, and 5 of the top 10 areas with poorest access to services in Northern Ireland and Fermanagh and Omagh. In the 4 wider determinants of health, which are income, housing, education and work, the Western area display higher levels of deprivation when compared against the Northern Ireland average. So the aim of paediatric occupational therapy for children and young people is to optimize their occupational performance and enhance their ability to function in their everyday lives. You can see that we use a model where the child is in the middle and we look at how they interact with both the home, community and in school. In the trust, occupational therapists provide an integrated service to meet the holistic needs of the child and their family in all aspects of their development. We work with children and young people and their families from birth right up to 18 or 19 years old. We work with children who have developmental delay, physical or learning disabilities, and young people whose functional difficulties significantly interfere with their performing the activities of daily living. Children's OTs also provide equipment, including postural wheelchairs and seating. We work in partnership with nurseries, schools, colleagues in education. A little bit about special educational needs. The Western Trust OT capacity is insufficient to meet the demand due to increasing population of children and young people with special educational needs, requiring placement in special schools, mainstream units, and mainstream classes. The Western Trust special school numbers have increased by 70% since 2015, with the EA predicting no change in this growth trend for 25-26. A high proportion of these children and young people will have ongoing needs for OT. In addition to increased numbers of children and young people requiring support with special school settings, OT services are further challenged by the geographical spread. So between 2022 and 2024, there has been an increase from 5 to 9 sites. 5 special school sites have now extended to 7 special school sites, 2 additional specialist classes for children with significant learning disability in mainstream schools. A little bit about the environmental adaptations process. So the assessment of need in relation to housing adaptations in Northern Ireland is led by occupational therapists who work across a range of service areas. This role has been delegated by the Trust to occupational therapists in order to fulfil its statutory duty underpinned by the Chronically Sick and Disabled Persons Act, which places the responsibility on trusts to consider the provision of housing adaptations for service users who are registrable. Historically, community occupational therapy were responsible for all paediatric major adaptations. Due to the change in population need and the specialist assessment skills required, they were unable to continue to offer this service as they lacked the appropriate training and experience. Paediatric OTs took on the responsibility of recommending major adaptations for children and are now responsible for the assessment and provision of complex housing adaptations of children with sensory challenges. So this is an additional piece of work and places additional capacity on already large caseloads. So I can take you back one slide just. So there, the special educational school numbers. So enrolment in special schools within the Western Trust has been increasing steadily over recent years, with a steep increase in enrolment each year since 2021. For example, there was a projected increase of 107 additional enrolment in September 2023, which would have brought the total to 1,154 children in special schools in the Western Trust, compared with 765 in 2016. So this represents an increase in enrolment of 50% over the last 7 years. The Commissioner for Children and Young People published her Too Little Too Late report in March 2020. It found that the education system is under extreme pressure and was finding it difficult to respond to the scale and complexity of special educational needs. The Education Authority has indicated that in September 23 across Northern Ireland it will require up to an additional 130 classes, 130 teachers and 260 classroom assistants to meet the needs of children who have special educational needs because of their severe learning difficulties. So within the Trust, there are 5 special schools, and the EA has indicated that there will be an at least additional 60 children in these schools by September 2023. So we have Ardnashee, which is soon to be 3 campuses across a large geographical spread. We have Rossmar, we have Knockaveau, we have Arvalee, which is 2 campuses, and Willowbridge. So we did receive some additional funding in 2022-23 of 1.92 whole-time equivalent band 7s. Not funded for historical gap though. The numbers rise from 743 in 2015-16 to 1,272 in 24-25, with the trend expected to continue for another few years based on the data from the EA. So the Trust, as the OT service, we're currently funded for 5.84 whole-time equivalent staff, which includes technical instructor. So technically we only have 5.24 staff. And that covers 5 special schools with a combined student population of 1,272. The identified capacity gap for special schools is 6.8 full-time equivalent based on a previous business case to be submitted to SPPG. Next slide. So this brings me on to the adult community OT. So in community OT services, we believe there's an interdependence between the environment, the occupation, and the person. So the person who's unique, assumes multiple roles, has attributes, skills, knowledge, and experience, and is motivated by their interest and culture. The occupation, and that's activities and tasks that are important and meaningful to the person in the areas of self-care, work, and leisure. And the environment, the context in which the occupations take place. Functional performance is maximised when there is a good fit between the three components. Next slide. So occupational therapists work with children and adults who suffer from mental health, physical disability, learning disability, and older people, and understand that the physical environment can be both enabling and disabling. A person's home can have a significant impact upon their ability to participate in the occupations that matter to them in terms of self-care. So that's attending to their personal hygiene, such as toileting, washing, domestic tasks such as cooking, cleaning, laundry. Productivity, this is accessing the community, employment, and carrying out caregiving responsibilities. Leisure, that's participating in activities in and outside of the home that bring in enjoyment. Unsuitable and unsupportive housing creates barriers to participation that can result in loss of independence and reduced physical and mental health. OTs work with people experiencing challenges in their home to identify solutions that reduce or remove these barriers, providing equipment that helps to reduce risks and makes activities easier to complete, recommending physical and structural adaptations that make the facilities in the home safer, more supportive, and easier to access, supporting people to move to a home which is more suitable for their needs, ensuring that new homes are designed with good levels of accessibility so that they are suitable for a wide range of people. Next slide. So this is the waiting list data submitted at the end of September 2023-24 and a comparison. So within the OT pediatrics in the northern sector, in 2024, we have 463 patients waiting, of which 425 are breaching the 13-week wait. The longest wait is currently 175 weeks. The position in 2023 was 425 patients waiting. Total breaching was 372, but the longest wait was 193. So we've been able to bring it down slightly in the year. In core community OT, total waiting is 2,287 patients at the end of September 24. There's 1,691 waiting over 13 weeks, and the longest wait is currently 132 weeks. The position at the end of September in 2023, there was 2,459 patients waiting. Total breaching the 13-week target was 2,086, and the longest wait was 128 weeks. A number of factors place additional pressure on already stretched paediatric occupational therapy services. So there's an increased awareness and recognition of neurodiversity, a population group that can significantly benefit from occupational therapy, a lack of capacity elsewhere in health, education, social care systems, increased mental health needs, and increased complexity of physical, learning, and mental health needs. Next slide. So this slide hopefully shows the demand that the community OT service is under and the capacity that we have to try and meet that demand and what we actually were able to deliver. Each month, referral demand outweighs the capacity of the workforce. If all our staff are in post and there are no secondary referrals, our potential capacity is 218 cases a month, which is well below the referral rate. What I mean by secondary referrals is when we have an open case and we have a long treatment tail, we receive another referral for the same patient, and we class that as a secondary referral. So while we deal with the secondary referral, it impacts our ability to then go and get new allocations off the waiting list. So in reality, we are never in a position to operate on full capacity due to the impact of secondary referrals and allocation of cases from vacant caseloads. Approximately 50% of secondary referrals are in relation to manual handling risk assessments. You'll see a wee dip in our actual capacity in July and August, and that's down to staff annual leave during the summer months. With regards to our staff in core community, we have 7.4 band 7s, we have 4 band 6s, 4 band 5s, and I carry just one gap at present, which is being recruited to. Next slide. And again, within paediatrics, the demand for the service outweighs the capacity that we have. Within our paediatric service, I have 0.4 of an 8A in clinical, 1.62 band 7s, 2.5 band 6s, and 2 band 5s. And I currently carry a vacancy of 0.2, which is 1 day. Next slide. Although it's not possible to compare trusts, as we're all set up and commissioned differently, the Western Trust sits at the bottom when it comes to the whole-time equivalent number of staff, the whole-time equivalent number of OT staff, and that's 19 behind the next, which is the Southeastern Trust. And I think it's important in this conversation that we remember the levels of deprivation within the Trust and the geographical spread. Next slide. So in this slide, I hope that I explain the complexities that are there within both the paediatric and the community OT caseloads. So we don't fit neatly into the integrated elective access protocol in terms of initial appointment, set number of reviews, or a defined period of intervention, and then discharge. Instead, our interventions are categorized by complexity indicators, which are used to reflect the extent of involvement in terms of the time for assessment, the clinical reasoning required, the option appraisals, the communications, and the interagency working. Level 1, which is non-complex, level 2, complex, level 3, highly complex. Moving and handling assessments with equipment provision would come under the highly complex category. Complexity is much more about the knowledge and skills required and time intensity required to move these cases along. Combined needs. Often therapists engage with families where there are several members of the same household with disabilities or multi-need issues. In these circumstances, the therapist will work through the necessary pathways across 2 or more people in the same home. Alongside the interventions required for the home setting, therapists have to assess for and implement interventions for respite settings, education settings, second home where there is shared parental responsibility, and decampment during construction work. Collaboration. So the community OT and paediatric OTs are responsible for the assessment and identification of need for housing adaptations in clients' own homes, thereby committing to significant public expenditure. Such a commitment carries a responsibility to ensure that recommended works are necessary and appropriate as per agreed regional criteria and are properly scrutinised and authorised as part of robust governance procedures. This is a very time-intensive process and requires significant multi-agency collaboration across other healthcare professionals such as GPs, consultants, housing executive, housing associations, grant office, architects, building control, planning departments, and lift and tracking house providers. Occupational therapy can be an intrusive intervention as it deals with the psychological and emotional impact of disability and life-changing events in the context of the person in the privacy of their own home, and sensitivity introducing equipment and making structural changes to the fabric and structure of the person's home. Managing this level of highly sensitive communication is time-consuming, and sometimes it can give rise to areas of conflict and protracted negotiations. Contingency planning. Often additional risk assessments and safe systems need to be put in place to protect the client and their carers. For example, detailed risk assessments in relation to stairlift usage. Emergency access and contingency plans have to be drafted, for example, detailing the actions the service user needs to do if their 3-floor lift breaks down. Constraints. Sometimes these can be technical constraints. They lead to protracted communications, collaborations, site visits and meetings. Financial constraints. Interventions are dependent on finite budgets, both for the health and social care and housing. Delays in provision often necessitates additional interventions to manage an interim. Compromise solutions. When there is reduced internal and or external circulation space, or where there are differences in site levels, the OT needs to option appraise a range of alternative solutions with the housing provider and the client and family. And finally, customized bespoke solutions. Equipment provided by community OTs and paediatric OTs is not always an off-the-shelf product. In these circumstances, a bespoke solution with a full specification brief has to be identified by the therapist following the implementation of additional specialist assessments. For example, molded seating systems, This level of intervention is very time intensive and takes place over a number of weeks and months. Some housing issues need to be resolved using bespoke detailed measurements and calculations. For example, working out storage requirements for equipment and medical supplies. So all of this helps to explain why therapists dealing with highly complex cases are unable to process client interventions in a short time frame, and highlights how therapists on an ongoing basis with continuous assessment, review, and communication processes which may last for months and in some cases years. It forms an evidence base to identify the caseloads within community and paediatric occupational therapy services should be resourced and managed with a caseload management system that reflects the complexity and the time demands. Next slide. So finally, just some service improvements to date. So within paediatrics, there's been some recurrent funding up to 2022, but there's a recognised historical gap. We have some staff overtime. We have development of Band 5 rotational posts to try and get staff with suitable experience. Recruitment of training posts to try and fill the gaps Band 5, 6 with competencies. And we have agency Band 6 approved to assist with waiting list management. Within community OT, we have partial booking system for clinic, incorporating validation and cancellation of referrals, triage of referrals at advanced practitioner level to screen out inappropriate referrals. We have approval of staff overtime to validate the waiting list now in October and November 24. We have implemented an Ask Sarah, an online self-assessment tool. It's a pilot project undertaken by the Western Trust through the Department of Health and has been developed as an additional resource to assist with independent living. And then we have our Timely Access to Safe Care QI project, which was run in the southern sector of the Trust with good outcomes. The aim of the project was to reduce the waiting times for low complexity level Band 5, and we were able to achieve that. And then batching of allocations by geographical areas to make best use of staff time. Next slide. I'd like to thank you all for listening. I'd like to thank, obviously, my staff for the work that they do under the intense pressure and often going above and beyond for their patients. Even with all these challenges, they have kept the patient at the centre of everything they do. Thank you.
Thank you very much. I will just open it up for questions at the minute, Patrick. I have Councillor Farrell online.
Yep. Thank you, Chair, and thank you, Patrick, for the really interesting presentation. Just like to apologise at the outset. I would have preferred to have been there in person, but at a parent-teacher meeting, which didn't finish that long ago, so I couldn't make it to Strabane. So apologies for not being there. The first thing I would like to say is that a thank you from the SLP to the entire team in occupational therapy. We know you're all doing an amazing job in very, very challenging circumstances. But I just want to touch on the waiting list, the length of time that it's taken for referrals, assessments, etc. And we've had this discussion previously in council, which has led to your attendance here. People are being let down currently. There's families out there that are waiting a very, very, very long time to get seen by professionals within the Western Trust. We've got the waiting list for children, which the longest wait at the minute is nearly 3.5 years. And for adults, the longest wait is approaching 2.5 years. People expect better, to be honest. And we note that the target waiting time is 13 weeks. And we're really not achieving that. For children, 92% of the referrals for children are waiting over 13 weeks. And for adults, it's 74%. So there's a massive cohort of people out there who have been referred to occupational therapy who need some sort of intervention, and it's not happening in a timely manner. That's frustrating for people right across this city and district. It's frustrating for people in this chamber because we're being contacted all the time about the waiting lists. And I'm sure it's frustrating for the staff right across the trust who want to get this work done in a more timely manner to help people as quickly as possible. So I note that the number of referrals is outstripping capacity, so the potential capacity and the actual capacity. So it seems to us that we need to increase the capacity, and I note that the Western Trust has the lowest number of OTs across all trusts in the north. So our question really, in a nutshell, is there's a target that people should be seen within 13 weeks. It's not being achieved by any sense of the imagination. And Patrick, your presentation outlined the challenges, which we fully accept. But what needs to happen for the 13-week waiting time to be achieved? Because that's what people expect. We know it's challenging, but can you give us any indication of what changes, what interventions are required to enable 13 weeks to be delivered for the vast majority of people across this trust and this council area? And I note if it's a resource issue, we've got the McGee is now the base for OT. Well, it moved from Belfast, so we're going to be churning out OTs here locally. Do we think that that's going to have an impact on capacity within the Western Trust? And if so, when do you expect to see some sort of benefit, some sort of reduction in the waiting lists? So that's my question, really. What needs to happen to deliver the 13-week target? Because people need to be seen quicker, and that's what we all want to see. Thank you.
Thank you, Councillor Farrell. I'll bring in Councillor Boggs, and then we'll take a few questions at the same time, if that's okay, Patrick. Thank you.
Very much, Chair. And similarly, on behalf of the Sinn Féin team, can I sincerely thank you all for the work that you do right across our communities. And we know, as elected reps, being in contact with these without the presentation, although stark is the only word that I'm going to use for some of the detail within it, we know how much pressure you're under when we are dealing with constituents who are waiting 2+ years, 3+ years on the services that you provide, and how challenging that must be for you as staff. You obviously care for people, and that's why you got under the role that you're in, and you are being placed behind barrier after barrier to be able to do that in the timely fashion that you would like to. So on behalf of Sinn Féin, just to thank you for the work that you are doing in very, very challenging circumstances. I suppose there's very little that I can add to what the previous speaker has said in relation to times, but I suppose from a child's perspective in particular, could you give us any information? Obviously, if children are waiting a much longer period of 3 years, if not more, it would be interesting just to get some information in relation to their transition between child services and adult services, and whether there is any impact on them when they wait longer. I know I dealt with a different department in relation to CAMS and the impact of transferring from child mental health services into adult, and because the waiting lists are so long, you may not be seen. If you're 16 coming 17 and you're waiting 2+ years, you may not be seen on the child services and then the adult. So coming from an educational background, a teaching background, the need is exponential. Like what is being seen in schools and then being translated into your own services is astronomical in some cases, where the level of need is just completely outstripping any resource there to deal with it. And it does come down to resource, and you're dealing as best you can with what you've got. But just on around that piece of child services to adult. Then just the previous councillor has touched on the recruitment of staff. And I know particularly you know, there was issues raised with the trust in relation to, you know, nurses training in this area and then not being able to pick up jobs in this area. If we were training more and more, you know, what would be the assessment that they would be able to take up posts within the Western Health and Social Care Trust? What we hear from a lot of people who train, and I suppose it's the same for people that I went to university to be teachers. You want to go back into the community that you know and that you want to try and serve that community as best you can. So, kind of your assessment on what the chances are of that happening if it were to come around, and then just coming from a rural constituency as well, just any assessment you would have in relation to the challenges that our own area presents to us. I would imagine, but I would like to hear from yourselves your assessment. I would imagine it is easier to deliver such services as this in a more urban area, such as Belfast, where you aren't travelling 10 or 12 miles between each house that you need to go and assess or each patient that you need to see. So I would just be interested to hear as well in relation to what you receive in comparison to other trusts, how, because of the reality of our own trust area, how that negatively impacts on how you're able to get that resource onto the ground, and what impact the reality has in relation to it, and whether or not you feel, I suppose, if that is being taken into account whenever decisions are being made above this level, obviously, in relation to what you receive in order for the service that you need to provide. But just again to reiterate, thank you for the work that you continue to do on an ongoing basis for the people within our constituency and right across this trust area. Thanks, Chair.
Thank you, Councillor Boggs. So there's a few there. Patrick, do you want to answer a few now and then I can come back to some more speakers?
Thank you, Councillor Farrell and Councillor Boggs. I feel the pressure of the waiting lists, and our staff feel the pressure of the waiting list. So what's required to get to a 13-week waiting time whenever we're sitting at for 3 years and 2 years respectively? We're trying everything that we can within our services, and I've outlined that in one of our slides. But I think it will require significant investment if we were to try and get it down to 13 weeks. We have good service improvement ideas. The staff are motivated, and we're doing some overtime, but we're well off the 13-week waiting list. Councillor Boggs, you talked about the transition. I don't have the figures for patients transferring in mental health services, so I come back through Chris, I'll get some information and I'll share that with you. There's no doubt the geographical spread of the Western Trust causes us challenges. What we do try and do is batch our allocations, and we try and use our resources as smartly as possible. But it does cause us challenges, Councillor Boggs. The levels of deprivation within the Western Trust, and I'll take it back to the slide where full-time equivalent OTs within Northern Ireland were the lowest. So we're spread really, really thin. And we do our best with what we have, but and I can't say it enough, the complexity within the caseloads, but the demand that is coming in on top, we just don't have the capacity to get to.
Thank you. Councillor McDade.
Thank you very much, and apologies for being a wee bit late. The traffic was a nightmare. Everyone looked at me because I should have been declaring an interest up until a few weeks ago because I was an OT in the trust, but I have since moved, so I don't have to declare an interest anymore. I have a couple of comments. First of all, Patrick, thank you. I think that you have touched on the complexities, but I don't think anyone truly understands what OTs deal with, not even our fellow professionals within the teams, because OTs work with all areas of all people, whereas a lot of other professionals specialise. And they work very specifically with different kind of either mental health, peds, whatever. With OT, we work with everybody. And I think the complexities it's impossible to get it across in a presentation. But thank you for trying to kind of explain it. And I think until you're in it, you don't really realise. So I just wanted to say that. And a few things. One thing is we know that most OTs are women. So whenever you're talking about you have one vacancy in community, what about the maternity leaves? Are the maternity leaves covered? Are they covered if you have if a band 6 goes off maternity leave, a band 5 might act up, but then is that band 5 backdated? So do we always have all the staff? I know that you have to allow for sick leave and all as well, and then on sick leave, the complexities are so extreme. Our waiting lists are so high, people are under so much pressure, so there must be a lot of sick leave. Because people are probably under a lot of pressure. And from coming from the trust and working in the OT world, I know how supported OTs are, and thankfully because of the line management that's there. But I think that OTs punch above their weight. Often, I can't speak for community or PEDS because I've actually never worked in those two areas, but I know that in other areas, OTs are often the one that you're an individual, you're just one OT within a multidisciplinary team, whereas there might be 3 or 4 or 5 nurses and 3 or 4 or 5 social workers. So you're the only one carrying out all that role on your own. So I think that investment is needed. And I think that it's a recognition from across other professionals that when money's coming down, there's always a lot of outcry about nurses and we need more nurses, but we also need the multidisciplinary team. We need the OTs there as well. It's really important. And from what the OTs do, in regards to discharging people and getting people seen and keeping people in their homes, which is really the push of the health service at the minute, is that we try and keep people at home in the communities that they know they have the support. OTs are literally at the centre of that. That's exactly what OTs do. It's all about keeping people independent, doing what matters to them at home in their own environment with their own supporters. So I think that when investment's coming down, I genuinely think it needs to be looked at on a trust basis, higher up, that the money's going towards OT. It's not always going the same way because sometimes it's who shouts the loudest gets what they want. And if there's less OTs, we're not going to be able to shout as loud as what there is of nurses. And I know, sorry, I know, Donna, you're a nurse, but I think it's really important that it's said. The other thing I just wanted to ask was since you moved the housing adaptations so it used to be adult community did the PEDS ones, and now the PEDS OTs do the paediatric ones. Has that had an impact? Has that reduced waiting times in the community OT? And has it made the kids OTs get seen a bit quicker? Do you know what I mean? Have I explained that all right? Just because that was obviously a change, I'm wondering what was the impact? Was it positive on the kind of service as a whole? But all that was all really. I didn't really have many other questions. I just wanted to say that thank you for coming on. Even though I'm not working in the Western Trust anymore, I still get people going, hey, my granny's been waiting for an OT to come out to do a stair lift for 3 years. Can you do anything about it? I couldn't do anything about it when I was in the trust and I still can't do anything about it. And it's really frustrating. And I think that, people, I think it does need to be publicised how much pressure OTs are under because very rarely will you meet an OT who'll come out and seem stressed because they'll come out and they'll do their best and they'll be nice and they'll spend an hour chatting to you while they're doing everything. And I think it's just important that people realise the pressure that they are under and that these big waiting lists aren't the OT's fault and they're not Patrick's fault and they're not essentially the trust's fault. They're to do with the kind of not enough funding has gone into our profession full stop from the start. And I know when Patrick, you took over, there had been I can't remember the figures, but your predecessor had said how many OTs had been, it had multiplied by so many since she took post. And I know that's one of your goals is that you're going to do the same again. And I have every faith that you will, because that's the only way this is going to be solved, is if we have twice at least the number of OTs in the trust than what we do now. But thank you very much for coming on.
Thank you, Councillor McDade. Councillor Hutton.
Thank you, Chair, and thank you all very much for coming on here today to present. And as Councillor Boggs has alluded to, it is a stark reality what we're hearing here today in relation to the pressures that you are all under and the roles that you do. But thank you very much for continuing to stick with it and try and help those that are under in your care. Suppose for me, I just wanted to touch on the adult adaptations and the equipment that goes into homes. As a councillor, we get many a phone call about equipment that hasn't been delivered on time, equipment that won't be delivered until 3 months later, and telephone calls about the length of time people have to wait if they needed a walk-in shower, removing a bath, etc., etc. And that all comes through issues around the housing and issues in relation to older people that are discharged home for care. So what I wanted to ask was, is there any grading exercise within what you do about the urgency of equipment to be delivered? This week I have dealt with a family whose older uncle had fallen out of the bed, but the new bed won't be delivered until after Christmas. I had a family who were getting upgrades to their home through the housing executive, but the walk-in shower couldn't be given to them
because the OT didn't make the recommendation. And I totally get that the OT has to make that recommendation, because it's not just putting on a walk-in shower, it's the adequate handrails, it's the adequate tiling and the floor surfaces, etc. So just because these issues are prominent in my mind today, I just wanted to know if there is any urgency put in cases like this, because the family that I'm talking about that didn't get the walk-in shower, the works have stopped. They didn't get any new bathroom at all. So they've been told that there'll be an 18-month waiting list for the OT to come out. Now, the housing executive have stepped in and are trying to alleviate that so that the work is done at this stage, rather than them putting in a new bathroom and coming back in 18 months' time to rip it back out again to put in the shower that's needed. And then in relation to the equipment, when someone is either discharged from care or is in the home being cared for, and equipment as needed, is there a grading process there in relation to the urgency of that care, particularly if 2 falls have been reported within the space of 3 weeks? But it's good for you to be here today, for us to realise how under pressure you are, how difficult it must be for you to do your jobs, and we are totally grateful for the jobs that you do under the stressful circumstances that you are working. But as councillors who are dealing with constituent issues, I like to go back with the answers that you can give me. Now, I have been trying to ring through to an individual within OT, and obviously they're a very, very busy person, but I'm hoping to get an email back. But it's just great that you are here today so that I can maybe get some of those 3 questions answered. And one more thing that popped into my head before I go, I'm keeping you too long. Is there what is the situation with the study, the OT degree? Is there many students coming forward to study? Are they getting opportunity to come on work experience? So, you know, we need to be looking at probably, is there an interest in the sector, and is there up and coming occupational therapists that could fill those gaps within the shortage of staff as well? Thank you very much.
Thank you, Councillor Hutton. So again, we have a few questions there, Patrick. I am a big pusher for the allied health whenever I'm doing the career stuff in school. Hopefully there's enough numbers, but I'll let you answer those questions, Patrick. Thank you.
Thank you, and thank you for everybody and for your understanding and appreciation of the challenges that are faced within the trust, and particularly with their OT services. Supposed to start with as well is just on behalf of all our patients and clients, you know, I'd like to apologise that we don't meet our 13 weeks and the challenges that that has for our families and the pressures that that puts on our staff, because we do acknowledge the challenges. Whenever we listen to our OTs who are coming in, and just what Councillor McDade was saying, it's very personal to them when they aren't able to meet the demands of in a timely manner for the people, and we do see the impact. And so for that, I'm sorry that we don't meet the 13 weeks. The services that we do deliver, we are commissioned by them through the SPPG. So we deliver on what we are actually commissioned on. And it's back to what a few people have alluded to as well. This is just about that investment of what we need for the demand that is continually rising. And we don't think this is going to change, sadly, for where we are at the minute, unless we have further investment. Patrick will come back a wee bit now, Councillor Hutton, just about the grading as well. But we do hope as well through the universities, if there is more investment as well, that the number of people who are put into training every year, that needs to increase. Because what we want to see, it'll probably take 3 to 4 years for them to come out, and then they're junior staff. And then we just need to work through the process. So we need to be looking now to make that investment so that we're able to meet the demands going forward into the future. Otherwise, you will see the demand going up and our capacity, which is commissioned by the SPPG to deliver, is reduced. And that has an impact on every patient that we are trying to look after. So I'll hand over to Patrick just to come back around where we are at the minute around some of the grading. Thank you.
Thank you, Donna. I'll go back to Councillor McDade, because one of the things that she mentioned was maternity leaves and workforce. So the process that we have within OT is we have a peripatetic team for Band 6 to cover maternity leaves. If a band 6 acts up to a band 7, then we have a really strong band 5 regional band 5 waiting list. And this brings me back to Councillor Farrell as well, because we have a really strong band 5 waiting list, because I do think that the impact of having McGee and allied health professions in McGee is having a positive impact. And the Western Trust is a really strong band 5 regional waiting list. The need for occupational therapy is clear. The commission places in the university were oversubscribed for. So we have more students wanting to do OT than we can actually educate. Councillor Hutton, you had asked about, we have a routine waiting list and we have an urgent waiting list. So the figures that I gave you today are for routine. We have a 12-week wait for urgent waiting list as well. What constitutes an urgent waiting list? That's somebody who has an urgent manual handling need, somebody who has palliative care, urgent end-of-life needs, somebody who's urgently been discharged from hospital. That's what we would diagnose, or we would move that then. If that was a change, we would move that from routine into urgent. I think Councillor Hutton, you had mentioned then just the waiting list for the band 5. So just as I said, we do have a really healthy waiting list for band 5s. We recruit once a year for band 5 OTs. It's regional recruitment. We try and do it once a year because of the numbers that we have to get through, and it's the most efficient use of our time. From a band 5 point of view, there's no shortage, and we have a good strong list.
Thank you. Alderman Hussey?
Thank you, Chair. I'm not a member of committee, and thank you for the opportunity. Thank you for the presentation. I'm reading into this that you simply don't have the resources to fulfill your responsibilities. And I'm wondering, if those 7 or whatever it is you're short did appear, would you have the resources to actually employ them? And how does that all fit in? That exponential rise in the number of SEN students in special schools, can you explain how that has occurred? Is it a greater identification of client need, or what may have happened? From 743 up to 1272, and I'm saying that as a former member of the Board of Governors of Knockavoe, and I realise the intensity of work that goes on there. I realise the difficulties that Knockavoe had because I was involved back when they were seeking expansion, etc. And I'm just wondering about that. Is there any indication of the number of SEN students located within the rest of the school system? Because that obviously impacts then within that sector. Like Councillor Boggs, the issue of transition is always an issue. And I'm aware of work that is done in some of the adult centres. I have 2 brothers-in-law who attend an adult centre, both of them. And sometimes there's a perception that they go to centres and sometimes feel abandoned in those centres. I know that the particular centre that my family members attend, there would be concerns as to the provision there vis-a-vis what they might get if they were in Omagh, although the Castlereagh Centre is an outreach of Omagh, so there is a concern. And the issue of care in the community has been rightly touched. I mean, it was talked about as a panacea at the time that would assist the entire health system, and I agree, absolutely it would, but it has to be resourced. And I suspect at times that administrators are penny wise and pound foolish. That if the money was invested properly in care in the community, the feedback on that would feed back into the main system and free up resources, etc. You made a comment, Patrick, different commissioning impacts on outcome. And then you talked about regional criteria. So there's different commissioning which impacts on outcome. And that was on the graph that showed the numbers in the Western Trust. But then you talked about that there's common regional criteria. So I'm finding it difficult to balance that, if you understand where I'm coming from. And can I say that, an intense presentation, and to be quite honest with you, I think I could have stopped you at every paragraph and had a wee chat about what each was in each of them, because of the complexity of the issues that we're dealing with. But thank you very much for the presentation. Thank you, Chair.
Thank you, Alderman Hussey. Councillor Tierney?
Chair, thank you. And apologies for being late to the committee. Thank you all very much for attending here today and for the presentation. I think it's always good to get people in who are going to tell us the reality of what's going on in a service. And I think when you look at the waiting list figures and the length of time it can take to see an OT, is very, very shocking, to say the least. Patrick, you spoke about staff numbers in community and in PEDS, and if I heard you right, you talked about, for example, having 2 band 5 in PEDS, 2 band 5 OTs in PEDS across this trust. I couldn't imagine what their caseload would be, but I would like to get some idea of what that might be, because if we've got people who are sitting on a waiting list for 2, maybe 3 years, and OTs are working flat out, what level of cases are they dealing with? Each of them across their bands, because I think that is going to be pretty high, to be honest with you. You talked about service improvement ideas, and if we're going to be totally honest about this, the only way that you're going to improve the service well enough to address the 13, to get down to the 13-week target, is by having more staff. That's just the reality, because if this service could have been improved to get to that point without more staff, I would imagine it would have been done by now. So the only way to address this is by employing more staff. What does that look like? How many more OTs do the Western Trust need to employ to get to start it realistically heading towards that 13-week target? And you also spoke in response to, I think it was Councillor Hutton, about an urgent referral list as well in terms of a 12-week target. What's the waiting list like for that, or is there a waiting list for that? Because whilst we're getting the figures for I suppose the routine referrals, I would worry if there is also a heavy waiting list for urgent referrals, and I think that that's something that I would like to know as well. So those are my questions in terms of trying to address the 13 weeks and get down to that target. How many more OTs do we need? And people have already talked about the students and what impact we would hope that they would have. How long, if you're identifying, for example, I don't know, 10, 20, 30 new OTs, how long, 100, how long is it do we get those in post qualified, in post, and start their work? How long is that going to take? Thank you very much.
Thank you, Councillor Tierney. I'll take one more, just Councillor Boggs.
Very late, Chair, because I've read about them, but it's just you have enough to do, so I don't want you going away doing something that I didn't ask for. Whenever I was asking about the children and adult mental health service, I think Chris picked up kind of what I was getting. I was just asking, we know that is an issue, the transition between children and adult mental health services. Do you experience a similar issue in going from children to adult paediatric services, and where there are issues of a child transitioning on to adult paediatric services? How is that best, or how is that managed? I think Chris kind of got where I was coming from, but I just don't want anybody going away doing any work that they don't need to do because you have enough.
Thank you, Councillor Boggs. Can I pass back? Is that okay?
Thank you. Come back to Alderman Hussey's just query just to where we are around the commissioning. Our services are commissioned through the SPPG and the Department of Health. So they would go per population. Now, We are doing work at the minute around population health, and a lot of that work will be taken forward as well through our integrated care board as well. So we are very aware within the trust the high level of deprivation within the trust, and particularly in certain areas. So we do feel within the trust that we have a special need really for more resources and more investment to be put into our OT services and other of our AHP services as well. But for today, our OT services, we feel just that demand is increasing. I probably can't give you an answer as to why we have more SENs there. I'm not sure if Eileen and Patrick would know that. I don't know if it is better, like everything we're recording. I'm not sure, so I couldn't give you an answer on why we have seen that increase within the last, 8 years since we have some of those measures. Whenever we're coming then on, I'm going to pass you over to Patrick to come back to just some of about the caseloads and just around service improvements to give a wee bit more detail around that there. But it is known that we are doing quite a bit of work now, starting particularly through the integrated care boards and our partnership boards around the population health. I think a big focus of that will be on health prevention and early intervention. So, and it's back to the point about the 13-week waiting list. If we could get in there earlier, how much could we prevent? And again, a lot of that is down to the resources and availability and access that we have. And it is back from the department what they commission us to deliver. So I'll hand over to Patrick. Thank you.
Thank you, Donna. Just Councillor, I suppose I would second what Donna said about the exponential rise. These figures are based from the EA, so certainly we do feel the hit of it. With regards to the commissioning in different trusts, I suppose what I mean there is they're set up in different trusts differently. So there are maybe teams that can take some of this work away in other trusts that we don't have here in the trust. So whenever I say commissioning and set up in different trusts, that's what I mean. There is regional criteria for paediatric and community OT, so we try and have the same criteria regionally. And that's what I mean by accepting patients onto our waiting list. That's the regional criteria. Councillor Hussey, Councillor Tierney, the staff numbers in paediatrics and communities. So we have 2 band 5s, but that's in the northern sector of the trust. So the trust is split into the northern sector and southern sector. For the purpose of today, I just kind of give the northern sector. So there's 2 band 5s for the northern sector of the trust. So just wanted to clarify that. We do have a skill mix within our profession. So band 5s are our new graduates. We take them in, we use preceptorship, we use competencies, and we try and train them up until they're ready to go to band 6. And once you get to band 6, you're looking at housing adaptation, specialist equipment, and then you move on to your band 7, which is your complex level 3 adaptations and equipment. So that takes a process of time as well from the seniors. But we do try and we don't want their band 5 feeling under pressure. We try and support them as best we can. It's a good question. How many OTs do I need to hit the 13-week waiting list? I couldn't put a number on it. But, I genuinely don't know. You had asked about the waiting list for urgent. It's 12 weeks for urgent. And then Councillor Boggs, you just talked about the transition from paediatrics to community. We do have interface arrangements between both services. We try and work those as best we can. So the handover then to core community, especially around housing, we have an interface arrangement between 2 services.
Thank you, Patrick. I have Alderman McMorris online.
Can I just say
Sorry, Patrick.
Can I just say the urgent figures? So the people waiting for urgent assessment are included in the figures as well. So that's not in addition, they're included.
Thank you for clarifying that, Patrick. Alderman McMorris.
Thank you, Chair, for letting me in. And can I say a real big thank you to everybody in the panel today for their presentation. although the figures are stark, it is great that you are in and we're able to hear firsthand just I suppose the complexities of what you are facing in order to be able to deliver on the outcomes. We know there are challenging circumstances, and it definitely, we all know that there needs to be a large injection of funding put right across the health service, you know, but I'm just going to touch on what Councillor McDade was saying, that basically the OT, you know, their job is very complex and they're in the heart of the community, you know, and they have multifaceted. But whilst they're not medical, the impact that an OT can have is life-changing for some of the people that we're dealing with. You know, it's a difference of them being able to stay at home with their family around them. So I just wanted to put it out there. And also, I just want to put on record too as well, Patrick, about any dealings that I've had with the OTs. They have been very prompt, professional, and they have a great level of empathy for the caseloads that they're dealing with. So they're doing a fantastic job. It's just unfortunate that we are in the circumstances that we are in regarding funding. But I just wanted to ask a couple of questions that you mentioned about the triage and the community. Is the pediatrics, is that triage too? And I'm sure it does, but what I'm trying to get at is I had an instance there where I had one of the constituents needed a armchair for the property because she wasn't able to get in and out of her chairs at home. Now, it sounds easy to me and you, just get a chair delivered, but they couldn't deliver a chair to this person because of the fact that an OT had to assess it to see whether the chair was at the right height. Now, I understand totally that, but you know, is there like a triage service where like the band fives can come in and deliver that? What, you know, what's the process of that? Do you know what I mean? Where they're like basically looking at the complex cases and something that can be delivered very easily in order to minimize the witness. And I also wanted to touch on the fact of bed blocking, and I'm sure that has an impact, and I know they're in-house OTs in regards to bringing people out of the hospital setting, but do you find that because of the waiting list, that there's people, you know, having to go into the hospital setting because of they can't get adaptations in time, or, you know, what is the impact of that? And also in regards to the educational settings, I know there was a big push for schools who had spare classrooms and stuff in order to offer them classrooms out for children to be put in there with special educational needs. I don't know whether you would have the figures or any information on that, but was there much of an uptick on that? You know, and is that making any difference? And just a last point, because I know a lot of this has been covered, but in regards to McGee and the students that we're seeing coming through in regards to OT, do we have much placements coming where they might be able to do a lot of the lower level stuff, which would help? I know they have to be overseen and stuff, but I'm sure there's a lot of things that they probably could do in order to lighten the load for the other OTs. So just but thanks very much. Look, and if we can touch on then a few points, I'd appreciate it.
Thank you, Alderman McMorris. Alderman Montgomery, online.
Thank you, Chair, for letting me in. I just want to thank all for coming into the chamber today. That presentation was a bit of an eye-opener. We understand that the constraints that you are under and what you do, but it's just a stark reality of what lies ahead. One of the issues you did mention was you'd noticed more children having sensory issues, and I'm a registered childminder, and I have to agree, there's more and more coming through, and it just makes me think, is there going to be a longer waiting list ahead as more and more are being diagnosed with issues coming along? Myself, I do have a child who's on the waiting list, and another issue would be, is she going to be seen before she transitions over to adulthood? But I know you have all covered that, and I really appreciate everything that you have done, and thank you.
Thank you, Alderman Montgomery. Councillor Harkin.
And thank you to all the Western Trust representatives that are in here today. Your comments are very, very helpful and very, very insightful. And from People Before Profit, we want to extend our thanks to all the occupational therapists, because we know how challenging the job is and how important it is. And the two things that I wanted to say are, one, I think it's very clear from your presentations and the burden of work that occupational therapists have right now is that there has been far too many years of underinvestment, and that is why we're seeing such long waiting lists that are really unacceptable. But the only way that that's going to be addressed is through investment that rebuilds the health service and makes sure that those waiting lists come down. And I'm concerned that despite promises from the Labour government, despite the restored Storm executive to focus in and prioritise the health service, that we're not actually going to see delivery in that. And that brings me to my second point, which is the OT staff. We depend on them, but we need them, and we are going to need them more than ever now. But we are seeing that once again there's another broken promise on pay for our health and social care staff, and I feel like it's like Groundhog Day. The Stormont executive goes back, promising that they are going to prioritise pay, particularly for health and social care workers, given the importance to our society of the health service. And once again, a very modest pay raise cannot be delivered on. And that is demoralising for the workforce, but it also undermines our ability to rebuild the health service, because we have to attract people. And my concern is that we are training people up to be OTs, but that we're going to lose them, and we're going to lose them to places in the south. We're going to lose them to Australia. We're going to lose them to other places where the pay is better. And this is a scenario that will actually only extend the waiting list, further burden the existing staff, and make it much more difficult going forward. So this is urgent, really, in terms of and look, if there is strikes, and I have a motion in the next week's full council meeting about this. If there is strikes, that will further that will impact children and others and families that are in need of these services, because there will be disruption. But I fully blame government for this, not the workers that are taking action, because those workers are taking action to save the service, which includes decent pay for the workforce, and this is a way to actually attract people to the health service rather than people running away from it because they're not being paid, they're not being valued, and they're overworked and overburdened. So thank you again for coming in today. And if you have any response to that, I would really appreciate it as well. Thank you, Chair.
All right. I'll pass back to yourself then. Is that okay after those few?
Thank you. I'll just come in just on the last point from Councillor Harkin, just around the pay. We fully support as a trust pay parity for all our staff. I think this is because it's out of our hands within a trust, but it is from a trust perspective, we completely support that there is pay parity for all our staff, including our OTs. I'm just wondering, in the interest of time, if Council would like us to take some of those as questions through Chris and come back, but we're very happy to answer those questions now. But I'm just wondering from the last few councillors if you want us to answer them, or we can take them as questions and come back, because we are very mindful of time. But again, we leave it up to yourself, because Patrick and I are very happy to answer.
Yeah, that's fine. I think we have two more comments from
Yes.
Councillor Tierney and Councillor McDade, and then if we're all happy enough, are we happy with that? Are we happy with that online? I know a lot of the questions came from there.
Yeah, and
All
I'm
right.
happy anyway for them to come back. So if we want to continue on with the next two speakers and then they can answer that, I'm totally happy. Yeah, thank you.
All right. Thank you, Alderman Morris. All right, Councillor Tierney.
Thank you, Chair. And I suppose in the interest of time, I'll not keep it way long either. I think all of the slides and the conversation that we've had today has shown us that OT, like many other areas of the Western Trust, has been underinvested in for years. I asked a question earlier on, how many OTs do you need to try and get down to that figure? You told me that you don't know, and you look quite surprised, Patrick, at even trying to guesstimate that. I assume you're going to be the exact same now, because I'm going to ask, how much do you think it's been underinvested, for example, over the last 5 years? Thank you.
Thank you, Councillor Tierney. Councillor McDade?
You'll be glad to hear mine. It's just a comment. It's not a question. But I can't help but jump in when it's OT because I'm very defensive of it and very passionate about it. So I think it was actually something you said, Aisling, about is there the numbers there? And I know, Patrick, you said we have a really healthy waiting list. When I first qualified 13 years ago, I couldn't get a job in the Western Trust. So I did the regional interview at the time, or I think it was an interview. And I had a ticket. Well, I worked as an agency staff first with Patrick, actually, not like Galvin, and then moved to the Northern Trust for a few years before I could try and get a band 6 back here. Whereas now people coming out of university, they all want to stay in the Western Trust. You know, there's so many. I had students right up until literally the day I left the trust. I had students final year who wanted to stay and they wanted to get a job. The problem is there's no jobs. There's no vacancies for them to even come under. It's, you know, it's just like, I don't think it's anything to do with people not wanting to be. Even yesterday I was doing a workshop in McGee and there was OTs there and they love it and they love Derry and they love Galvin and they love Grantia and they want to stay, but there's just not the job. So I think I would love to see, and I don't know whether this is possible, something from council, and it's something maybe to discuss at a later time, but like to go back and ask SPPG, why is the underinvestment? Why is the Western Trust less invested in? What's their criteria? Why don't we have the same numbers? Because actually the geographical area is so much more spread out, and we have the lowest level or the highest levels of deprivation. We have so many reasons that we need the investment, but that hasn't happened. So we need to be asking the questions, but it's not for us right now. I'm conscious of the time as well, but I just wanted to jump on and say, and I'll probably want to defend something else again, but I won't. I'll not come back on now, but okay. You can ask me questions later and I'll answer them, please.
Thank you, Councillor McDade, and thank you so much for coming on today and for all your work. I'll be very brief as well, but just to say, as a teacher, we see that the levels of SEN are also so high and the numbers are rising, and I can't just imagine how challenging and frustrating this weight is to the families and staff. And as somebody said earlier, you get into that job because you care, and I've seen it firsthand with grandparents and OTs that have gone out with them. They care. So thank you so much for your hard work and thank you for coming on, and we look forward to hearing the answers to our questions. But thank you so much, and you don't have to stay for the rest of the meeting or anything. But thank you.
Thank you. Thank you for having us today. Thank you for your support and again for your questions, because that's where we'll go away and we'll find out some of the answers and we'll come back to you as well. And we will project what our need will be, Councillor Tierney, as well, and we'll look at the underinvestment as well. So thank you very much.
All right, members, thank you. We have two pieces of chair's business today. The first one is just from myself and Karen. It's a consultation that closes on the 29th of November, and it is on working with you to transform general surgery. It'll be circulated electronically to members, and it was received in the post. Issue the papers, and it closes on the 29th of November prior to our next meeting, so it's just so everybody knows about that, but it will be circulated. And the second is Councillor Hutton. You have two pieces of chair's business, yes?
Thank you. Well, I just do the two, Chair, together. So my first piece of chairperson's business is in relation to the event that's going to be on in the Guildhall on Saturday from 11 o'clock to 3 p.m. and that's going to be run through the Life After Charity and the Northwest Road Safety Partnership. We were at the launch there a few weeks ago up in the church on the walls, and they were looking for this event to be promoted. So basically this is an event that obviously we had spoken in the past here in council about the number of road deaths, particularly with our young people, and one that has been most recent here in Ballymacquarie over the past week.
So the Life After charity are a charity that support the family after a road death, and trying to help them come to terms with what has happened. And that's not just immediately after the accident. There's care given to the family throughout the next year. They join up with Northwest Road Safety Partnership, and they kick off the Road Safety Week. This event is going to be in the Guildhall on Saturday, so it's called Road Safety Saturday. And what it'll feature will be like car crash rescue demonstrations, showcases from key partners that are dedicated to make our roads safe, and that includes the PSNI, the fire service, ambulance service, Department for Infrastructure, and other community organisations. So I just wanted to highlight that day for council. There is some posters and that online on Facebook. So that's this Saturday at the Guildhall from 11 to 3. Thank you.
Thank you, Councillor Hutton. Do you have another piece of chair's business?
Sorry. So the next piece of chair's business was something that I wanted to highlight as well in relation to the Women's Listening Ear survey that's out at the minute. Our very own Derry Well woman partnered with Queen's University Belfast and the nursing and midwifery team to develop a questionnaire which will hopefully inform a women's health strategy here. I was at an event with a group of women that I am currently working with in relation to menopause services here in the Northwest on Monday night in Stormont, where the Listening Ear survey was launched. It was launched by Karen Meehan from the Derry Well Woman and Sandra McNeil, a local retired obstetrics and gynaecologist consultant. Mike Nesbitt, the health minister, was also present. We had other guest speakers, including women with lived experience. So this survey is a very, very important piece of work. I'm very proud of it because it's coming from an organisation here in Derry who have taken the initiative and went ahead and done this in partnership with the university. I did see Adele McCourt sending it out through our channels, through the members groups. I just wanted to encourage council to send it out through their social media and target the ladies that are employed within the council and any partners as well. It is a survey for women only over the age of 16 plus, but it's to highlight the fact that this survey is going to inform and hopefully develop an action plan and a costing for organisations and women like ourselves who are campaigning to present it to the health minister to get this developed. So, and to commend the Derry Well women as well for all their hard work. Thank you very much.
Thank you very much, Councillor Hutton. We'll move on to item number 7 then, which is matters arising from the open minutes of the Health and Community Committee held on Thursday, the 10th of October. Do you have a proposer? Proposed by Councillor Boggs, seconded by Councillor Clark. Thank you. Item number 8 is Healthy Cities and District designation, and we have Seamus taking us through it, but we also would like to welcome Adele O'Doherty and Claire McEnany for a short presentation as well, but I'll pass over to Seamus first.
Thank you, Chair. Members, the purpose of the report is to seek approval to continue supporting the WHO Healthy Cities programme, which includes Phase 7, which commences in 2026. The report outlines the history of the Healthy Cities Network, the role of the Mayor and members, and good practice across the network, and also outlines financial implications. Developing Healthy Communities have been coordinating this initiative, and I'll pass you over to Adele now to give you an overview, including the draft Healthy Cities plan.
Good evening, elected members and council officers, and thank you very much for giving us this opportunity to update you on the work of the Derry and Strabane Healthy Cities Initiative, and to seek your input into the next phase, Phase 8 of the WHO Healthy Cities Initiative. So we're at the next phase of beginning to engage with a number of stakeholders. So we want to start with yourselves because you have your fingers on the pulse and you're out there in the communities. And we want to hear the feedback so that our next application to the World Health Organization's Healthy Cities Initiative is a true reflection of the needs and ambitions of this city council, city and district council area. So my first slide there. As Seamus mentioned, developing healthy communities, lead on the Derry and Strabane Healthy Cities Initiative on behalf of the Council and the Public Health Agency. And just a little bit of background about developing healthy communities. We're a charity based in Ebrington Square, and we deliver a wide range of programs which are aligned to the WHO Healthy Cities Initiative. We are a dedicated team of 13 staff that work tirelessly with multiple agencies, including local communities, to promote health and wellbeing across Northern Ireland, but a strong focus on the Derry and Strabane District Council area. I'd like to say that though we're a small organisation, I believe that we have a very big impact. But given the challenges within our Health Council area, we have much work to do. And as a WHO Healthy City and District, the involvement and support of yourselves is critical to our work. And you heard Donna Keenan talking there about the importance, though the previous presentation was about service delivery and the amazing work of our trust colleagues. The focus on many of the strategic policy documents is around prevention and population health, and that's the space that we occupy. So developing healthy communities really started about 30 years ago. Initially, we were Derry Healthy Cities, but the organisation was founded by John Main, who was your previous Chief Environmental Health Officer. So the roots of our organisation is within the council. And John was a great visionary. He wanted to make connections with the World Health Organization's global Healthy Cities Network, which comprises of 88 cities throughout the world. Our name was changed about 5 years ago as our remit evolved, and we now take on projects which extend right across Northern Ireland. However, as we're based in Derry, we have a strong focus on our council area and the rural area. I want to emphasise that. And this is justifiable because of the health inequalities that exist within the West. Our projects include the CLEAR project, and Claire leads up on the CLEAR project, and that project focuses on community capacity building, particularly in relation to mental health, suicide prevention. We deliver training on suicide prevention and mental health, and we are responsible for the CLEAR standards, which we audit organisations that deliver mental health interventions to ensure that they have good governance. So the CLEAR project is one of our major projects. We also run the Family Voices Forum, which is an advocacy group for families bereaved by suicide. And that Family Voices Forum works very closely with the Chief Medical Officer to shape and influence mental health and suicide prevention policy. We have our Live Well, Work Well project, which is a project which goes into workplaces to improve health and well-being of staff. And we spend a third of our lives at work, so we want workplaces to be places where health and well-being can thrive. And of course, we coordinate the WHO Healthy Cities membership on behalf of the council. So last year we administered £371,878 in the CLEAR small grants funding to organisations within the council area on behalf of the PHA. And we reached 8,519 beneficiaries. And it's important to note that although we organise and deliver and administer this funding on behalf of the PHA, as a charity, we just make a small management fee on top of that. So I'd now like to focus on my next slide on the role of the WHO Healthy Cities. So as I mentioned, we've been a WHO Healthy City for over 30 years and a designated healthy city in 3 phases of the programme. Phase 8 begins in 2026, but there's a requirement for cities to gather a substantial amount of information as part of the application process. It's likely that the phase 8 of the Healthy Cities programme, Healthy Cities and District programme, will be once again adopting that holistic approach to health and wellbeing based around what they call the 6 Ps, which is people, place, planet, prosperity, participation and peace. And it's interesting that I noticed that our draft programme for government had a number of those Ps in it as well. And it also, the work of the WHO also reflects very closely with our strategic growth plan, which emphasises and recognises that health is created in the context in which we live our lives, in our communities, our homes, our cities, our workplaces. It's known as the settings approach, and also takes account of the wider social, economic and commercial determinants of health. It's important to note, however, that the WHO Healthy Cities is a political movement, and the designation sits with our mayor, and we have met with consecutive mayors over the years, and all of the other cities have very strong political involvement in the process, and I suppose that's what we aspire to with working with yourselves. Derry and Straban's district partnership has enabled us, with the WHO's enabled us to tap into global expertise and the latest thinking across a wide range of public health related areas. And what we do is we share that information extensively with all of our networks, and we can tap into subject areas such as air quality, obesity, active travel, food systems. All of this expertise is out there. And member cities are encouraged to create healthier, more sustainable urban environments by integrating public health into urban planning, housing, transportation and energy policies through health in all policies. And again, that's an aspiration we have for this council, that we adopt that health in all policies approach. So next slide, please. So according to the WHO, a healthy city is not one that has achieved a particular health status. It is conscious of health and striving to improve it. Thus, any city can be a healthy city, regardless of its health status. The requirements are a commitment to health and a process and a structure to achieve this. So what does our healthy city and district look like? Next slide, please. So firstly, political support. You can see there that we have engaged with a number of mayors over the years, and we do have great support from all of our mayors. And we want to build on those relationships and the alliances with each of the elected members. As a designation for the WHO is 5 years. So therefore, we're keen to establish a more longer term relationship with you, so we can use the WHO Healthy City and District framework to maximise our collective efforts across the city and district. And I really believe that the framework, the WHO Healthy Cities and District framework, is a great vehicle for and a mechanism for bringing forward and bringing together lots of great initiatives that are happening all across the council area. So next slide, please. Access to global expertise. As I mentioned, we have been enabled to tap into some of the greatest minds within the World Health Organization in terms of public health. And we do link with local communities and all of our stakeholders to share this information. Last year, we were fortunate that Dr. Ciara Fortin, who is the head of the WHO Healthy Cities movement, came to Derry as a guest speaker at our annual conference. This year, we had the endorsement from Christopher Bailey, the head of the Arts and Health from the WHO, to formally open our conference on creative health. And we had leading experts from Manchester and London Healthy Cities to also share their expertise and knowledge. We learned from cities across the EU and the UK and the Irish networks of healthy cities who are all doing great work across a range of areas such as sustainable food systems, etc. However, it's not a one-way relationship, and developing healthy communities have also influenced policy at EU level. A couple of years ago, we invited Gary Rutherford to present at the WHO conference in Copenhagen, and he talked about recovery in communities, and the group that he presented to were very impressed at that work, and they hadn't really been considering it. So they adopted that into a major policy for alcohol called turning down the tide or turning off the tide of alcohol within the WHO. So that was a great achievement on our part. Last year at the WHO conference in Utrecht, I presented on the Council's Natural Capital Account, which is a process which was used by the Council to quantify the health benefit of the 9,000 acres of greenways and parks. And that project evidence that they were contribute over 80 million to health and well-being of local citizens. And once again, many of the WHO healthy cities were very impressed by this, and we shared that information across the WHO. So slide 7, please. Next slide. So collaborative action. So as you can imagine, a lot of our work is closely aligned to the community, voluntary and statutory and private sector organisations. The WHO would say that promoting health is about advocacy, capacity building, and empowering communities to take health into their own hands. Martin Luther King was once quoted as saying, of all the forms of inequality, injustice in healthcare is the most shocking and the most inhumane. In this city, we have some of the worst health inequalities across Northern Ireland, and we believe in developing healthy communities. And as part of the WHO Healthy Cities, a Healthy City and District, that our role is about agenda setting, lobbying, advocating, convening, capacity building, and sharing knowledge and best practice so that people and communities can take that knowledge into their own hands and be empowered to take action. And I think we're very, very fortunate that there are many examples of good practice within our council area where ordinary people and communities and indeed workplaces are leading the way in health development work. So next slide. So this is just a few practical examples of some of the work that we've been involved in. You can see there the Sustainable Food Network activity through the Acorn Farm. And that's with Strabane Community Project. There's work there on active travel. You can see there, I know it's small, but it's the We Carry On mural, which was led by Hive Cancer, which originated through DHC when we secured funding along with the Northwest Community Network and Ulster University, for significant monies to support 15 community groups to work with the university with an academic community partnership to look at local issues affecting mental health and wellbeing. So there's also a few pictures there of workplaces who we've been supporting to improve health and wellbeing, looking at stress management, etc., and take them out to enjoy the nature and mindfulness sessions, etc. So next slide, please. So despite all of the great work that's going on in Derry-Strabane District Council area, as you're well aware, we suffer from some of the worst health inequalities across the north, and mostly within the 20% of the deprived areas. And these are well documented within the Chief Medical Officer's Health Inequalities recent report. The next slide there, I could give you lots and lots of statistics and information and data about health inequalities, including the disparities between life expectancy for men in the most deprived areas being at least 5.1 years of a difference, and for women 3.1 age gap between women in the most deprived and the least deprived areas. However, for the Western Trust area, the main, and indeed the Derry-Strabane District Council area, the main areas for inequality are drug and alcohol related deaths and admissions to hospital, and lung cancer admission rates. So next slide, please. So again, many of our health challenges focus on diabetes and obesity, and they're deemed to be the twin epidemics of the 21st century. And we have, for instance, 18,000 people in the Western Trust with type 2 diabetes and an additional 10,000 people with pre-diabetes. And we are leading on work in relation to that. And our Mayor, Barr, recently launched that Western Diabetes Group. There's also an estimated 26% of the population living with obesity, and at least 65% of the population are deemed to be overweight or obese. So quite compelling statistics there. So next slide, please. So what are we doing as far as developing healthy communities is concerned? So despite all of these challenges, we're working in partnership with many, many agencies which contribute to a broad range of health and wellbeing initiatives. We support council-led initiatives such as the age-friendly, the child-friendly, and the Climate Commission work, and we hope to be involved working with the council on the whole systems approach to obesity. Through our collaborative programs at community level, we're involved in the Neighbourhood Health NIP project and the SCAIC Health Inequalities Initiative. And in partnership with the university and the Northwest Community Project, the Northwest Community Network, we leveraged on 772,000 for the Ideas Fund, which I mentioned earlier. Additionally, we have significant conferences on health innovation and creative health, which has really brought experts from all over Europe and Ireland, elevating our region's role as a leader in health transformation. So next slide, please. Our assets and initiatives. Sorry, let's see where I'm at. Selected. Okay, sorry. I mentioned there about the Ideas Fund, 15 community initiatives. We also have mentioned there about our conferences and our new groups that we've established recently around diabetes, creative health, and health inequalities. And then, of course, we work to skew our resources from other projects, such as the CLEAR initiative, towards the WHO Healthy City and District. So slide 14. Sorry, next slide. So what's next and how can you help? As phase 8 approaches in 2026, we have an opportunity to define our district's vision and mission for the coming years. The new phase will focus on sustainable long-term actions and a wellbeing economy. We need strong political leadership and your endorsement of these plans to bring our community closer to our goals of health equality, climate resilience, and a robust local food system. Your support will be invaluable. As council members and health leaders, your influence is crucial in advocating for health in all policies. We ask for your endorsement for our strategic actions and your backing to allow us to address emerging work on health inequalities and to secure the next designation of a World Health Organization's city and district. So in conclusion, I invite each of you to partner with us on this journey towards a healthier, more inclusive Derry and Strabane. And with your support, we can build on our past achievements and drive meaningful change for the benefit of all of our residents. So thank you very much.
Thank you so much, Adele. I'll pass back to Seamus. Have you a recommendation that we read through?
Yeah. Thank you, Adele, and members. Just to summarise the recommendations that Adele has put forward there, is that council members consider the draft Healthy Cities and District Plan and also consider the incorporation of health in all policies into council services going forward. Thank you, Chair.
Thank you, Seamus. Councillor Hutt.
Thank you, Chair, and thank you, Dale, for the presentation, and you as well, Seamus. I might need to declare a bit of an interest here in relation to Dale and Claire, because we received CLEAR funding at the Bogside Brandywell Health Forum, and we work very closely with Dale as well. But just to put that out there, it's not a bad thing; it's a good thing. But
what of an interest?
Eh? So it's not my fault. Can I just say what's really striking about all of the stuff that's up there, Dale, and the stuff that's talked about all the time, is that where you live actually determines how long you live. And through the Health Inequalities report that we have seen published this year, the figures are shocking. You could sit on here all day and go through them, and it ranges from how many women have breast cancer, right down to children born with fetal alcohol syndrome. It's just a vast list of health inequalities that are existing in our district at the minute. So I would be happy to endorse the recommendation that Seamus has just put is. I think it's really, really important that we continue to support the work of developing healthy communities, supporting the work that the vehicles of work that come from like the CLEAR project, the Family Voices Forum, which we saw an amazing seminar this year from them, which was in the Guildhall itself. people speaking from lived experience, and all of that trickles out into our community, whether it's through community organisations, if they're going into schools, if we're going into workplaces. So I think for us, we have a responsibility to the 150 odd thousand people that we represent here in this city and district to try our best to put everything we can into the fact that we need to be building healthier communities, because that's not just about how long you can run. That's your mental health, that's your physical health, it's your nutritional health, it's your oral health, it's your foot health. You could go on all day. But all that holistic approach to it is where we're going to start making that change. Maybe some of it's systematic change, Edel and Claire, but I think from council's perspective, being involved in that process is where we need to be, and supporting the work that goes on with developing healthy communities. So thank you very much again for coming along, and I'm looking forward to seeing what progresses and how we're going to approach the 2026 initiative with the World Health Organization. Thank you so much.
Thank you, Councillor Hutton. I'm taking it you're happy to propose.
I will propose. I
Thank
get
you.
carried away and forget to propose.
Thank you very much, Councillor Hutton. Councillor McDade.
Thank you, Chair, and thanks, Seamus and Adele and Claire. And I'm happy to second the proposal. And just very briefly, I suppose Ashley's touched on it all already. Like, I mean, the Health Inequalities Report showed us that if you're a man, you live in Bangor or somewhere in the Southeastern Trust, you're going to live 8 years longer than what you are if you live in Strabane. That's just stupid and unfair, and part of it's to do with investment, because investment's driven by how life expectancy. So if there's a longer life expectancy, you get more money in there, so that stops people living longer. It's just a vicious circle. So no, anything we can do with the council to support this and push it forward. I think given the previous presentation, which was all about underinvestment in the Western Trust, we just need to all holding hands and working together to kind of push this and do what we can to provide a healthier community for everybody here. But no, thank you very much for your presentation. It's brilliant. Thank you.
Thank you, Councillor McDade. Councillor Boggs.
Yeah, very quickly, Chair. Thank you very much for coming on. But could I just ask, could we get that presentation? I know we have the actual report within our pack, but we don't have the presentation. There were some stats in that on it, if you don't mind. Thank you.
Thank you very much. Thank you very much again, Claire and Adele. That was really informative. And we'll get that circulated after. But thank you so much for coming on. That's great. All right, on to item number 9, which is consensual action plans for Fahan, Spare and Strabane Town and Waterside DAA's additional good relations funding. And Barry's going to take us through this.
Thank you, Chair. Members, the purpose of this is to seek your approval for the consensual action plans, and this is similar to recent reports we've had for other areas in recent months. So you'll see in section 5, we're seeking your recommendation to approve the action plans for Fahan, Spur and Strabane Town Waterside for this financial year. So Fahan DA Strathfoyle Community Association, £4,000. Spur and DA Rapid Limited, 4,000. Strabane Town Fountain Street Community Association, 4,000. And Waterside DA Hillcrest Trust, £4,000. Thank you, Chair.
Thank you, Barry. Councillor Boggs.
Yep, Chair, happy to propose, and just some of the detail within the action plans. I think is really, really good, particularly the Strabane Town one relation. Obviously, the good relations, their own relation, good relations, but some of the works that is contained within them. So just happy to propose and support them. Thanks.
Thank you, Councillor Boggs. Proposed by Councillor Boggs. Do we have a seconder? Councillor Hutton. That's great. Item number 10 is Cooperation Ireland's Voice Matters initiative, and that's Barry again.
Thank you, Chair. Again, this is to update you on the Voice Matters report for this year on the People's Panel, including the shared outcomes and recommendation of this year's project report launched in St Columns Hall in October 24. And members, this is also to seek your approval that the existing Northwest Ministry of Youth is utilised as a youth voice in line with the Children and Young People's governance structures for our council area. Members, you'll see there's quite a bit of detail in the report. The main purpose of bringing in this, as well as for information, is just to get your approval around that. So the recommendation within the report you'll see relates to the establishment of a youth panel. And members, we've highlighted, and you'll be aware that the Ministry of Youth is already established group which provides a youth voice, so we didn't want any duplication. So that's the main purpose of this report, so that you note the content of the report and you approve the existing Northwest Ministry of Youth as utilised. So proposed.
Seconded.
All right. Councillor Hutton, did you want to speak?
I was just going to propose and briefly say how very important the youth voice is in shaping our communities.
Thank you. Very. Thank you very much. Thank you, Barry. Item number 11 is safety initiative relating to e-bikes and e-scooters. Now, Seamus.
Thank you, Chair and members. I don't intend going through the report in detail. And I just ask that you note the approach taken by Council to address the safety issues relating to defective batteries in e-bikes and e-scooters. Thank you, Chair.
Thank you, Seamus. Do we have a proposer?
Opposed.
Proposed by Councillor Boggs. Seconder? Councillor Clark. That's great. Item number 12 is update on the sunbed test purchase exercise. And that's Seamus again.
Thank you, Chair. Members, the report outlines the enforcement action taken in accordance with the Council enforcement policy relating to test purchasing of sunbed use. Members, the report clearly outlines the legislative framework prohibiting the use of sunbeds by those under 18 years of age. 11 premises were visited, 3 fixed penalty notices have been issued at 250 each, and it's just for members to note the enforcement action taken. Thank you, Chair.
Thank you for that, Seamus. Councillor Tierney.
Thank you, Chair. It's not on this actual paper, but it's related to it, so I'm happy to propose the recommendation. Councillor Hutton forgets to do it. I forget the words to do it. But anyway, no, I propose the recommendation. But just on a similar note, Seamus, and Chair, you'll remember that we had a conversation a few months back around test purchasing of vapes and a report coming around that. When are we expected to see that report, and is there any update on that at the moment? But I'm happy to propose this one on the sunbeds.
Through you, Chair, a report will be brought back in the September committee in relation to the tests. December.
September?
Sorry. December. December.
December?
Yes. Apologies. Slip of the tongue, sorry.
Thank you for that, Seamus. And thank you, Councillor Tierney, for bringing that up again. That's great. You're happy to second. That's great. Right. Item number 13 is Cares for All Families campaign, and that is Barry.
So I think Barry has deferred upwards. So members, just to provide you with detail of the CARES initiative and to ask for your consideration of the recommendations. We did receive a generic email with a combined petition, and it's made some asks of Council in relation to passing a motion writing to the Health and Education Ministers and lighting up Council's buildings in pink. We consider that there are no specific implications of the report at this stage, but ask you to consider how we might well take forward the requests within this document. Thank you.
Thank you very much, Karen. Councillor Clark.
I'll propose this, and it's just that, you know, we feel in Sinn Féin that all those who require care at home should be afforded high quality care at home to maintain their independence and preserve their dignity. And also those who are going to provide the care as well should be given a high quality standard of training as well to carry that out, you know, when the provision of hoists and other devices such as the manual handling and lifting training as well. That's very important. But also coming from a social work background, I've worked across family intervention and primary care and older people's teams, and the direct payment scheme really does need an overhaul. It can be quite tedious and it can be quite challenging for people to go through the application process. So I would be all for that. And just finishing on that lady who wrote in, Ms. Henry, she said, by standing together and visibly supporting this cause, we can bring about much needed attention to these issues and apply pressure on decision makers to take meaningful action. So I'd be happy for it.
Thank you so much, Councillor Clark. So we have a proposer. Do we have a seconder? Councillor Hutton. That's great. Thank you very much. So we have a few items here for open for information. So I'll just run through them, and if anyone wants to speak, just pop your hand up. So we have item number 14. No. 15. 16. Councillor McDade.
Thank you, Chair. And you know, I'm going to keep it brief because I know everyone's really tired now, but item 16 is the update on the strategy for ending violence against women and girls. And I just think, given, I know we've talked about loads, and we had a special council meeting last week, but I think we need to keep talking about it. I think we need to keep talking about what we can do locally. And I know there's an update there, but I wonder would it be possible, and it might not be, but could we as a council ask for representatives from the executive office to come down and give us a report and give us an update on what's happening and kind of timeframes on that. And just one other thing was, I know that the women's groups who had presented last Friday were coming in to meet with council officers yesterday or today. I was wondering, was there an update? Is there anything kind of come of that? Because I know there's another meeting, another public meeting tonight. So it's just to kind of get a wee update. Thank you.
Members, in relation to the work with the executive office, we met about 10 days ago with Claire Archibald, who is obviously leading on the delivery of the strategy. I think there was reference made at the special meeting of council for the potential of a change fund to be administered via councils should the internal departmental business case get approval. We're awaiting to see whether that approval will come prior to Christmas or shortly after Christmas. And what we have been asked to do is to look at the development of a scheme with some potential for momentum funding between now and or the approval of the scheme in March, and then obviously funding for the 25-26 financial year. So we continue to liaise with the department as to how that might be best developed using existing council grant aid processes, and obviously what might well be eligible or ineligible within that scheme. So there's been further considerations, I think, by some of our staff today, just about trying to get a more definitive timeline on that piece of work. And certainly, yes, the department have indicated that they would be keen to come and speak to councils, and there has been an indication from officials just prior to the special meeting of council that including sort of first and deputy first ministers, ministers and junior ministers, there is a willingness to attend events and initiatives if details are made available to the department. So again, our staff are looking with the wider collective of community organisations as to how that engagement might take place. So in relation to the collective of women's groups, obviously the lead Democratic and Improvements officer convened the special council meeting. We met as an officer team to look at the 10 requests. Obviously, for various organisational reasons, not all of the council directors were represented because some were on alternative business. So we've started to scope out where we believe council is currently engaging in work and what we are delivering right across the 3 directors, but also through PCSP and other sort of partnerships to look then at what is the potential with regard to those actions. So we've agreed to bring a paper back into the next senior leadership team, which sets that out for the wider approval and endorsement of the senior leadership team, and subsequently for a paper then to come to yourselves as an organisation. We're conscious that some of the asks were in relation to activity during the 16 days. Again, that's been scoped out, and I think there are a number of very specific asks that the Mayor is considering, and there's been some communication around that today. So, we will be responding and looking at all of that. So in the interim, a range of officers will provide advice and support in relation to aspects of that ask around, event organisation and so forth. And that process is underway. Just conscious that it is a very short and very challenging timescale to have, support there. There is no specific resources attached, and the change fund timing doesn't really tie itself and lend itself to the immediacy of this programme, but hopefully it will be there to support the longer term development of a programme of activity. So that's where we are, and either Barry or myself happy to take questions. Thanks.
Just you said you'll present a paper to the next senior leadership meeting and then another paper after that to the next committee meeting. I'm just wondering what's the kind of time frame like for when's the next senior leadership meeting, to give us an idea. It'll be a couple of months time before it comes back before us, just because I know people are going to be asking, because we know things can feel like they're slow, even though I know there's so much work being done to help people with the 16 days of action. It's just
I just need to check the dates, but we will go back to the collective group to give an update to them in advance, and we did agree that we would do it before I think the first event is the 25th. That they have asked for in their calendar of activity. We go back a few days before that. So if there were issues or difficulties, we had an opportunity to look at how those could be addressed and taken forward.
Thank you, Councillor McDade, for raising that, and thank you, Karen, for all your work on that as well. That's great. Thank you so much. All right, item number 17. 18.
Chair.
Oh, sorry. Mr. Councillor Harkin. Sorry, Councillor Harkin, I did see that and it completely left me. Do you want to come in now?
Thanks, Chair. Yeah, I do. Is that okay? Yeah.
Yeah, sorry,
Yeah,
yes,
look,
no problem, Sean.
Yeah, it's just look. There's a report there on the advice quality control audit that our independent advice services went through, and I think it's great, the report, that they all did really, really well. And I think for the council, this is very good value for money, but it is also very, very important work that they're doing with our residents. And just to say, look, we know, because we're on the advice panel and we engage with them, that they are continue to be underfunded with more work, and that doesn't seem like it is going to end anytime soon. So we have to be thankful for the work that they do, and it's impressive that they're able to get such stellar reports given the pressures that are on them. It is noted in there that we had a discussion about Advice Pro, which is the recording system that is used for engagement with clients or for people that are being helped or trying to access help. And I think that it was a bit more than a refresher training. There is an issue with Advice Pro, and all of the independent advice providers have talked to us about it. They're frustrated about the way that it works. It actually seems to be getting in the way of their work rather than assisting them. So I think what we should do, and it's not a big proposal, but I think it's something for us to do is, for a report. I think we should engage with the existing advice providers and the trialists about how Advice Pro works, and try to get a sense of, like, if something needs to be radically changed. Because I don't think that there was also issues about access and training for Advice Pro, where it's costly, difficult to access, geographically difficult to access. So I think that this is, given the pressures that already exist on the independent advice services, and because of the lack of funding, I think that we want to make sure that we're doing everything we can to make sure that they are able to focus on the main job, which is helping people, and not have bureaucracy get in the way. So I think we should agree to have a report done on the working of Advice Pro based on follow-up discussions with the advice providers and the trialists. Thanks, Chair.
Thank you, Sean. Karen has said she's happy to take that on board. Councillor Tierney?
Thank you, Chair. Thanks to Councillor Harkin for bringing this up. I first of all want to commend all of our advice service providers who are working under very difficult circumstances. And as you'll see from, I think it's 3.4, happily, and they've all received a gold standard in terms of the advice that they provide to people across this district. These are providers that are working under extreme pressure, trying to support people who are struggling and need that advice. So the fact that they've all received a gold standard, I think is a very, very good achievement. I sit on the advice services panel for the SDLP, and I can report that, don't know whether I'm allowed to do this or not, but they were all within 95% in terms of where they scored, which is really, really high. But that being said, and I've said this from, I think I've come onto this council, there's not enough money for advice services. There's just not. We need more. We, as officers, continuously lobby DFC for more funding to support these organisations so that they can support people within our communities. and it has never ever come. Doesn't matter what minister is in place, it never ever comes. And the only investment that we see in advice services across this district is investment from this council, i.e. the 2 trial providers that are there this year to try and take some of the load away. I think we have to intensify that lobby with DFC to try and get more funding in place, because this is going to be another question that we're going to be facing in a couple of months' time whenever we're talking about setting the RITS agenda going forward for next year. Councillor Harkin's right in relation to Advice Pro. There was conversations with all of the providers and about how difficult it is to navigate Advice Pro, how expensive it is for the organisation to purchase it and to be able to run it, albeit they have to have it as part of their commissioning agreement, so it's not optional whether they want it or not. It's part of their commissioning agreement. I think that's something that either we or the department together need to look at, because I think we were told for 5 logins for Advice Pro, it costs over £5,000, and that's taken right out of their commissioning agreement right away. So that's money that is there by this council, through the department, through this council, to support people within our community. There's £5,000 right away being taken away for administration. I am happy. I would be delighted to see a report on Advice Pro, how it works and how we're supposed to go through it. But in reality, we are there as an advice panel to support those advice services providers. We as elected members don't know even what Advice Pro looks like. So how are we supposed to provide that support? So I would suggest, first of all, before we look at a report, before we do all that, that the advice services panel are showing a demonstration of Advice Pro in terms of how you do it. I've been told by advice services providers, now this is crazy if it's true, that the first page asks you for the person's contact details, right? Then it asks you for their email address, which is understandable. It then asks you for their second email address. 2 email addresses being asked for is crazy in my mind. But you know what the next question is? Your third email address. Thank you, Councillor Hutton. Who has 3 email addresses? And why does any organisation need to record 3 email addresses for the one person? They've already got their name, their address, their telephone number, their national insurance number, and the date of birth. Why in under God do you need three email addresses? So there's a lot of information, as I understand it, on Advice Pro that isn't required. I was also told that whenever you're providing the notes on Advice Pro, you also have to show where you got this information. So if you're providing advice around filling a PUP form, for example, you have to tell all of the descriptors and why you think that person A may be entitled to 4 points for preparing food or 2 points for eating and drinking. You have to do that all out, right? You then have to tell them how you know this. So you have to provide in every single appointment that you have to provide your knowledge and your qualification. That's incredible. Chair, if you don't mind me saying, you're a teacher. When you're in a classroom, I'm pretty sure that every time that a class is leaving your room, that you don't have to provide your teaching qualification, just to show them. Now, just so you know, folks, I actually know what I'm talking about because I was taught this. I'm pretty sure that doesn't happen. I have no understanding why this happens in advice and when you're using Advice Pro. But what I do know is they're doubling the work. They're doubling the work for advice services providers. What that means is that our advice service providers are technically only seeing half the people. It's absolutely crazy. So I would like to suggest that before we have a report brought back on Advice Pro, we need to actually find out how it works. Because what we are also being told at that meeting is that the 3 providers currently use different ways. So I don't think anybody knows how Advice Service or how Advice Pro works, or how it should be worked, or what information is required for the department to register this as a contact. So we need to have an advice services panel meeting, in my view, an advice services panel meeting with Williamson Consultants, whoever else has knowledge on Advice Pro, to take us through it, let us understand it, and then we have a discussion around whether we need it, and then we bring a further report back then. There's no point, in my view, with the greatest respect to Councillor Harkin, there's no point getting a report brought back, again with the greatest respect to council officers, from a council officer telling us about something that we don't know about. It's not going to, you know, you need that on the job knowledge. So I think we need that description first of all before we go any further with the report, Chair. And that's a proposal that I wish to make, and I apologise for rambling on, but people are talking about what they're passionate on. Advice services is my bag, and we need to make sure that people are getting the support that they can get, but we also need to make sure that it's effective and efficient.
Councillor Harkin, are you happy to incorporate that in your suggestion?
I'm happy to do that, Chair. Thank you.
All right.
Just to point out, he's not incorporating his suggestion. Mine is a completely different suggestion. Mine's, and this is with respect to Councillor Harkin, mine's is that we find out about Advice Pro before we get the report. His is about having a report. I think they're two separate things, to be honest.
Councillor Hutton, sorry.
I would be happy to second Brian's proposal in relation to that report, involving all of that, the logistics of that reporting system, because as you've rightly pointed out, the advice services workers are inundated day on day. They just don't sit and fill out forms. They're trying to signpost people on the other wraparound services within their own communities. And if the paperwork is holding back that service being delivered, then we rightly need to know why, how, and if it can be amended. So I'm happy to second Brian's proposal.
All right. Are we all in agreement? All right. Great. Perfect. Alderman McMorris, are you looking in?
I was looking in there, and I think Brian has said most of what we need to hear. I agree 100%. There's a lot of discussion around Advice Pro, and we don't know what it looks like. So I'm wholeheartedly agreeing. But I just want to put on record, I sit in advice services for the DUP, but just to congratulate the 3 advice services because of the excellent outcome that they had in gold standard. As Brian alluded to, the scores was fantastic. And I just want to put on record our thanks and for the wonderful work that they do, which is really, really beneficial to our council district. Thank you.
Thank you, Alderman McMorris. Barry's going to give us a wee update.
Yeah, it's just Councillor Tierney on the update. Remember, we can contact Advice NI on that, and they'll be the ones that will provide it. In terms of Williamson Consultant, he wouldn't be the adequate person to actually show the system. He's there to record the data. He takes a number of bits and pieces of data off that we assess against the management agreement. So we'll have to write to Advice NI and ask them to come down. But most councillors on the panel will be aware. We're struggling to get them down to provide training to our providers. So I'm not sure what the response time will be in terms of coming to give that update, but we'll impress upon them the urgency and the debate here in the chamber and at advice panels in terms of we really see this as necessary. So we'll be able to update you at the next committee meeting and also through the next advice panel meeting as well.
Councillor Tierney?
Yep. At the last panel meeting, it was made clear to the advice panel by the providers that there is an issue with getting them to come down over the Glen Shane to provide training. That's no secret. If this was anything else, I would happily say that I'm happy to go to Belfast to have this out with them, but I'm not. They need to get used to coming down and providing the training here, so they should start. They should start with the providers, but if we can drag them down and make them realise that we've got the new road, it's not that bad as what it used to be, that they can come on down. But why are we using Advice Pro? At whose behest is it that we are insisting that Advice Pro is part of the commission agreement?
Through yourself, Chair, that's the one system, that's the one compatible system that the EFC have approved as well. So it used to be the Karma system used to be the old system. And since I can't remember the number of years now, but that is the one system that all providers are now using, that are funded through DFC and local councils.
So would we be in a position to tell the Department for Communities if we are in support of our advice service providers who are not getting adequate support for Advice Pro, that we are no longer putting it on? Would we be in a position to do that? Because that's the only way you're going to drag them down, is by threatening them.
persuade. All right. Thank you. Do you want?
I'm not sure, I'm not entirely sure what the question was, Councillor Tierney.
If they're not coming down, can we tell the Department for Communities that we're not using it until they come down to provide training?
Not using the system, then we would have no way of recording the data, and ultimately then the providers wouldn't be able to deliver on the commissioning agreement, so we wouldn't be able to provide funding, and DFC wouldn't be able to provide funding. DFC require data and recording from us, so if that's not, we do that on a quarterly basis. So if providers aren't recording data and we're not using the system, then there'll be no funding coming and down to council and ultimately out to providers.
So in short, no.
Yeah.
A good try though. Councillor Boggs?
Not on the advice panel, so not aware of everything that we're talking about, although Councillor Tierney has given us a broad overview over the last 5 minutes. But whether or not what Brian has just said about, you know, polling recording it, do we know, or has the advice panel made the department aware that we aren't content? I'm not looking at you for an answer, by the way. I don't know why I'm looking at you. Have we had any discussions with departmental officials about the issues that advice services are experiencing with the recording?
Through yourself, Chair, you'll see there's some details within the report that's around the quality control about our providers getting the gold standard, but also the discussions at the last panel meeting, and one of them was providers' concerns around VicePro. Also, there are concerns around training and the cost of going up to Belfast every time a new employee comes on board, and could we. So one of the actions after this paper today is that we will write to the department around Advice Pro, around Advice NI, and also speak to Advice NI. So that'll be two of the organisations we speak to following discussions at the advice panel.
Thank you, Barry. Councillor Harkin, are you looking on this again?
Yeah. Look, I think a lot of what Councillor Tierney laid out there is good, in the sense that I'm fine with going back to the advice panel, getting more details from providers as to how this system works, and us seeing ourselves all the details. But we already know that there is a problem, because we've heard it now probably for years, and it's become more apparent you know, over the last, I think, 6 months, just how frustrated providers are with this. So that is ultimately going to have to lead to a report that comes into council. The sooner we get that, the better, in my opinion, because I think we have to go to the DFC, because there has to be some sort of recording system for this information. Otherwise, we jeopardise funding from the department, and that we will be proposing changes to it. And I think that is going to be the next steps. So I think, look, we already know from the advice providers. I'm happy to kind of get an engagement with Advice NI about how they see how it works. But it's really how the providers are, the frustrations that the providers have with it, is the absolute key thing. And so they're frustrated about different aspects of it. I think that when we have our advice panel discussion, when we get the input from the providers, when we have more of an engagement with Advice NI, the outcome will need to be that we have a set of proposals for the DFC about how to reform this system to make it more manageable for people and less frustrating. So, you know, I mean, I just think it shouldn't take. We don't want to be waiting now another 3 months before we are even in a position to start talking to the DFC about what we want to see go forward. But I'm happy with the proposal as it is.
Okay, thank you, Councillor Harkin. Right, I'm going to move on then. I think I'm on 18. So 18? No? I did say about the Darren Saran Policing and Community Safety Partnership. Does anyone want to speak on that?
I do.
Oh, sorry, go on ahead.
Chair, the report is, with respect, very short. Is probably the word I'll use. I understand that these meetings have been paused in terms of setting them up. Is that still the case?
The meetings that where people
DCSP, where people view the body worn footage.
There are no further meetings planned or have taken place, I think, for quite some time. That's my understanding, but I'll have to clarify because Philip, as you will see from the report, did the research in terms of this particular item.
Can I just ask that whilst these are paused and whatever work is going on in the background, that before the play buttons hit, that another report comes to this committee, because I have got serious concerns in relation to GDPR issues around this, and I would like to know that we as a council are content with it before we tell the PCSP to go ahead. I would like to have a discussion within this council before we do that. So I want another report before it goes back to PCSP to go ahead, if that's okay.
No problem. Thank you, Councillor Tierney. Item number 18? No, 19?
19, Chair, not a member of committee, but I need to declare on 3.1 I'm a member of Castlereagh Royal British Legion with regard to an entertainment license application, and with regard to the road closure in 3.4 I'm a member of Castlereagh Events Committee. Thank you. Non-pecuniary.
That was under 19, was it, Alderman Hudson? Perfect. All right. Item number 20? 21? 22? And 23? All right. Sorry, okay, Councillor Tierney? You all right? Okay, can I have a proposer and a seconder from the confidential proposed by Councillor McDade, seconded by Councillor Boggs?